Rachel Grice is a contributing fitness editor for Livestrong.com and a certified yoga instructor. Previously, she was the science section editor and titling associate for several other sections of Demand Media Studios, including fitness, nutrition, and technology. She completed her undergrad education at the University of Southern California and has worked for Men's Health, Fit, Pregnancy, and People magazines. No one looks forward to going to the doctor's office, especially when most guys have the mentality of why go to the doctors if I don't feel sick. But the truth is, it's better to be proactive about your health than wait for something to go wrong. That's why Livestrong.com put together this list of every medical test men should have done in their 20s, 30s, 40s, 50s, 60s and beyond. Because it's never too early or too late to take better care of yourself. While you may feel young and invincible, but a healthy life starts in your 20s. Medical tests men need in their 20s. Young men have time and, for the most part, health on their side. But you should take control of your health now, so you're not facing down 40 with a spare tire around your gut and a bunch of pill bottles in the bathroom. While you probably don't need regular annual exams, it's not a bad idea to find a doc you like and start with at least one full checkup, including baseline height, weight, and blood pressure. A good internist will also listen to your heart, lungs and the carotid arteries, checking for any abnormalities, do a skin check for suspicious moles, look in your mouth, ears, and eyes, and check your lymph nodes and abdomen for any lumps or bumps. You need to know what normal feels like, and now is a good time. While you might be surprised to find out that the risk for testicular cancer actually peaks in your 20s, says Gary Rogg, M. D. internist at Montefiore Medical Center in Bronx, New York. It's wise to do a self-exam probably monthly, doctor. Rogg says, but talk to your doctor first to get a feel for what you're looking for. Most men don't know, which can lead to a lot of anxiety and unnecessary testing, says David K. Spindell MD, internal medicine practitioner and divisional vice president of medical affairs at Abbott Diagnostics. You'll probably need a few shots in the arm or butt in this decade, in part because some immunity from childhood vaccination has worn off, and in part to match your lifestyle. Get a tetanus booster and ask about a Tdap, tetanus, diphtheria and acellular pertussis, which also includes a diphtheria vaccine. If you travel abroad, get a vaccine for hepatitis A, and if you didn't get it as a child, you also need Hep B, says Dr. Spindell. Finally, if you're still in college or in the military, be sure you're vaccinated against meningitis. The Centers for Disease Control and Prevention (CDC) recommends that everyone get screened at least once for HIV, but you should definitely get checked if you've had unprotected sex with multiple partners, have sex with men, have injected drugs, or just to play it safe. Read more: the 10 most annoying men's health issues and how to fix them. Maintain the healthy foundation you set up for yourself in your 20s to continue being healthy in your 30s. Medical tests men need in their 30s. Here's your 30s in a nutshell. You can still walk the walk, but this is a decade for taking stock. Dr. says outwardly healthy men can be developing heart problems during these years without a clue. We know from autopsies done on young men who died, for example, in accidents, that there are often early signs of atherosclerosis, he says, which is a precursor of heart disease. An annual physical now will look the same as it did 10 years ago. An assessment of weight and blood pressure, heart, lungs, lymph nodes, carotid arteries to look for any abnormalities such as heart murmurs, breathing problems and early vascular issues, but becomes a bit more urgent. Keep up the testicular self-checking, too. Surprisingly, testicular cancer is more common in younger men than older ones, says Rog. Now's the time to get a fasting lipoprotein blood test for good HDL and bad LDL cholesterol, as well as triglycerides.